Hi, everybody. My publisher has asked me to remind you that my books make great Father's Day giving. If you, I know your father-in-law would want to read about health policy. We are the Colorado Foundation for Universal Health Care. We want to get health care for everybody. Seems like a basic idea. It works medically when everybody has health care, we have a healthier population. It works financially. A coordinated single-payer health care plan will always be cheaper than the fragmented crazy quilt system we have now, and it meets the fundamental moral obligation we have as humans to care for our neighbors when they're sick or injured. So we want health care for the entire universe of Colorado citizens, but within that universe, there are various communities that are particularly affected by our rotten healthcare system, and we're going to go through some of them now, and they're all equally important. So I'm going to go down by people's names alphabetically, which means I'm going to start with Emmett Blaney. Is a brand new, fairly new addition to the board of the Foundation for Universal Health Care. He's a hard worker, he's a smart guy, he's been a great addition to our board. And he also turns out to be an articulate spokesman for the LGBTQ plus community. So Emmett, tell us about the effect of health care.
Leading with articulate is setting a high standard. Happy Pride. My name is Emmett. I'm a board member. I'm also proudly queer and transgender, and I'm grateful to be asked to represent my community. We're not a monolith, but I hope to do us justice, at least for the purposes of the panel. The LGBTQ plus community has historically and is currently discriminated against widely in the medical world by doctors, health insurance companies, big pharma, and the U.S. government. Healthcare justice, as we know, is social justice. And for the queer and trans community, these stakes are often raised. Healthcare justice is often life or death. I'll speak to my own experience when I say that being trans in the U.S. at this moment is really scary. We're being pushed to the margins by a hostile government that threatens our happiness, our well-being, and our lives. Trans healthcare is one of the most prominent scapegoats, but make no mistake, we're the easy targets of a movement that seeks to regulate everyone's bodies. One of the most important things today that I'd like to share is that even if you aren't part of the LGBTQ plus community, the attack on our healthcare probably impacts you more than you realize. By rescinding access to healthcare that is viewed as only for trans people or only for queer people, millions of straight and cisgender people also lose access to vital services as the government attempts to be the arbiter of who is deserving of healthcare. By limiting access to things like STI testing, hormone replacement therapy, surgical procedures, equity training for providers, and other things that are currently under attack, all of us lose access to vital forms of healthcare. I kind of view trans healthcare as a litmus test, or a canary in the coal mine. I couldn't decide on my metaphor there. Will we allow the government or oligarchs to decide who is deserving of health care? The LGBTQ plus community may be one of the first targets in this era, but as we know, women, low-income families and individuals, BIPOC patients, undocumented patients, disabled patients, other marginalized communities will follow. Healthcare is a human right and one that the LGBTQ plus community needs your help to fiercely protect. And I thank you for joining the fight. I've also been asked very briefly to just touch on the intersection between environmental justice and healthcare justice, as I work for an environmental nonprofit that leverages nearly 700 former EPA volunteers to assist communities pro bono by providing consultation and subject matter expertise through our pro bono technical assistance program. I'm sure we all know the forces that create healthcare barriers for marginalized communities are the same forces that by design ensure that these communities are disproportionately exposed to environmental harms. Colorado boasts gorgeous mountains and some of the best access to outdoor spaces in the U.S., but you might not know we are also home to the most polluted zip code in the country. The 80216 zip code, encompassing Globeville and Elyria, Swansea, remains at the top ranking of communities impacted by metrics of exposure to Superfund sites, brownfields, polluters, and poor air quality. Unsurprisingly, the GES neighborhood is heavily working class, Latino, and was heavily redlined. Their proximity to the Suncor oil refinery, multiple interstates, and lack of grocery stores contributes to higher rates of gestational diabetes, congenital abnormalities, diabetes, asthma, and a 24% higher death rate than other Denver neighborhoods. Healthcare justice is directly tied to environmental justice and therefore directly tied to racial justice. Working toward a healthcare system that understands these intersecting layers of power and oppression is paramount. Thank you.
Thanks, Emmett. So it's going to be 90 degrees today and tomorrow, and under that hot Colorado sun, man, there's nothing like a cold beer to kind of make things go more smoothly. And if you happen to be in Fort Collins, the place to go is Horse and Dragon Brewing Company. Fabulous beer and a wonderful place. And it has several employees, and they have to have health insurance. And that's where our next guest, Tatum Cochran, comes in. Tell us what it's like running a small business under our healthcare system.
So I think we can agree that the system is broken. From a small business perspective, and speaking for myself, not everybody, again, but a representation of the small business folks we represent and talk with, healthcare shouldn't be tied to employment. It's genuinely unmoral, amoral to do that. From when we offered we're too small to be required to offer a healthcare plan, but we did for our employees for 9 years. They unanimously, all 8 full-timers, unanimously voted to accept raises instead of having a company-sponsored healthcare plan because they were able to get better plans on the open market with lower deductibles and lower costs to them, even with the company subsidy that we were providing. So the other piece of that is that, especially in small businesses, the person who is the administrator of the healthcare plan is not an expert in healthcare. They wear 9 different hats. They have 5 minutes a week dedicated to making sure that the premiums are paid. They don't know how to select a plan. They shouldn't know every health detail that all of the employees need out of a healthcare plan. And so they're forced into choosing 2 plans, hoping that enough people sign up for each of them so that we can administer those, and then having that perspective inform the healthcare that's available to their employees. When the pool is all Coloradans, then that negotiating power is significantly better than when there's 8 people working at Horse and Dragon, or 10 people working here, 20 people working here, even 100 folks. I don't know where the breaking point is where you actually have a full-time person who administers a healthcare plan who is an expert in that, but it's definitely not in the small business category. My favorite kind of statistic on this is in order to keep our healthcare increases below 12% annually, which that was a good year, our insurance folks were like, it's great news, it's only 12% this year. In order to keep that down, our deductibles for our employees raised every single year significantly, to the point that it was really basically catastrophic coverage. Everybody that voted that way, which is everybody, was able to find a plan with a lower deductible that fit their health needs better on the open market. If we raised the price of a pint of beer 12%, only 12%, remember, that's a good year.
Yeah.
12% every year since we opened, you would be paying $24.35 for a pint of beer. And while that would enable us to do even more good in our community, that's just not something that we're able to sustain. So yeah, that cost increase in that 10 to 12% range being the good news is not something that's sustainable for small businesses. And it's basically saying to folks, when we tie employment to healthcare, it's basically saying that if you are unemployed, you don't deserve healthcare. And that's something that's just wrong. So that's our perspective.
Thank you. As you heard, I rather rudely accosted Ruth here, Rose, a minute ago, and you were great. It was fabulous, and you're right. We need to get labor on our side. Another group that did not support us when we had a single-payer plan on the ballot were the reproductive rights organizations, and there was a clear reason for that in Colorado at that time. It was unconstitutional for public payment of abortion or reproductive care. We've now gotten rid of that constitutional limitation. And so I get the chance now to ask a very active and knowledgeable person working in the reproductive rights field, Kierra Hatton-Sena. Does that mean you'll be for single payer now?
I've personally always been for single payer.
Thank you.
And working in the reproductive rights space, it hurt me that because of Amendment 5, which was passed when I was 3 years old by not quite a 2% margin, that our entire reproductive rights community had to oppose access to universal health care, broke my heart, to be very, very frank. And so we spent a lot of time, starting from 2020 through 2024, working to pass Amendment 79, which did two distinct things. Repealed the public funding ban. That Amendment 5 did, which was why we had to oppose single payer and universal health care. And the other thing that it did was grant Colorado the right to access abortion. Hard stop. No limits. No. But the thing is, first of all, I need to say thank you. There are so many people in this room. I started actually listing names that carried petitions for us, showed up and did this work, because we know that we can't do this without the solidarity of everybody, which is why I'm here in this room today to help you push this forward. And thank you for showing up for us so that we could get to a place where we could do this all together. I'm so deeply grateful. And when I made that list, there were so many names, I was terrified to miss someone, so I stopped. So thank you. I think the thing that, we work for access for healthcare. Right now, that's we're very abortion and reproductive rights focused. But we're watching, we watched the labor and delivery ward in a town very near to me. I live in rural southern Colorado. La Junta just closed their labor and delivery ward. Parkview has downsized. The birth rates are going down, and more people are choosing to go to other hospitals. We have lost 50% of the OBGYNs in Pueblo, Colorado, because they keep trying to ban abortion, and the OBGYNs think that's hostile to their workplace, because it is. It's also why we're getting doctors from other states coming to Colorado.
Yes. Because
we have created a safe haven for providing OBGYN care, not just abortion care. And by passing something like universal health care, we expand that safe haven for providers. And we will get, and this is sad for the rest of the country, because we're going to get it done at some point here in the future. We will get more providers from other places in the country because they can have a work-life balance, and they can pay their bills, and they can treat patients the way they actually want to treat patients instead of having to rush the process. Because right now, you're all operating, if you're a provider, under circumstances that are not acceptable and they're not reasonable. And we heard that really clearly earlier. So it's really important that we continue to further these processes, because we are losing access to health care all across rural Colorado. You've heard that in this room before. It has hit me hard. I no longer have a family practitioner in my community. In Reid, Colorado, we're a population of the expanded area is about 8,000 people, and we're 40 minutes from Pueblo. So we are losing those providers over and over and over again because of these mega conglomerates. So passing this is so instrumental in expanding all versions of healthcare for everybody in Colorado and maintaining that incredible way of life that we have here, so that you can choose to live in the mountains and work remotely like I do, so that you can choose to live in a city and have easy access to healthcare, so that you can make these decisions and they're not based on all of these things that are hurdles in our way. And Colorado is poised to do that. We have an amazing electorate that turns out typically the second or third highest in the country, and that bodes well for passing universal health care. So, that focus on passing, and we know what it's like in the reproductive rights community, how to win a ballot measure. We've both won a big ballot measure, and we've both killed a lot of really bad ones. And we know that takes a lot of work, and I was not asked to do this, but I'm doing it anyway. Please donate. Campaigns are wildly expensive. We had to raise approximately $15 million to pass Amendment 79. Abortion is one of the most popular issues, second only to the economy in the state of Colorado. What you will all be up against in terms of passing universal health care, and we will all be up against, is that we did not have to battle insurance companies. And they stand to lose. So we have to prepare for that battle, and we have to raise money like we've never seen before for one of the more expensive ballot measures we will likely see in the state, and it's also totally doable. Don't let that money scare you. The people will want this, and people power will always outvote money as long as you have enough money to get to the people. So I'm going to leave you on that, and please do ask questions if you have them.
Thank you, Kierra. On the point you made about raising money, in the 2016 when we had single payer on the ballot, we raised about $870,000 on our side. That was really good money for an initiative campaign in Colorado at the time. The insurance industry spent $8 million against us. That's what we're up against.
Yep,
so you're right,
exactly
we have to raise money. Now, one of the things that's really been delightful for us older types on working on this issue is to see young, strong, articulate people come along and work for universal health care and work with the Foundation for Universal Health Care. One of the hardest working and most effective advocates currently working with our group is a guy who happens to be in a wheelchair. So let me introduce Michael Neal and tell us about the impact of health care on the disabled community.
Thank you, Tom, for the introduction. Certainly, sitting amongst this panel, I have learned so much in terms of how to be a good organizer from them. That am I, one of the leaders up here? Sometimes it feels like I do a good job. Sometimes, but more importantly, to this particular topic, is that I am a not quite so young anymore person, young man with a disability, and what that means for my ties to single payer, which I've always supported, is a number of things. And what it means in the most generalized sense is that I cannot possibly imagine what sort of employment I can take whose risk pool would be large enough to accept someone that has had 18 surgeries, that has fairly continuous, although the last 5 years have been thankfully very doctor-free in general, care throughout my life. It's going to be a disability that is a lifelong disability. It was from birth to death, and insurance companies don't like that. And so I don't know if I'm going to, if the piece of surgeries will slow down. Maybe I get away with, something in my mid-20s of surgeries by the time I end up passing away. But I cannot imagine, unless it's a really gigantic pool, that I will ever be someone that an insurance group will want to take. Luckily, I don't have to worry about that, and luckily, that's why I have been evangelizing for my entire life on the benefits of Medicaid. And as a person with a disability, I have Medicaid up through my 18th. I was about age 18. I was able to due to medical malpractice that caused part of my disability. Everything that you see above the waist that is a little funky, and why my arms don't necessarily move quite the way I would necessarily like is entirely due to that. So I was able to win a fairly hefty settlement, which, of course, according to Medicaid rules, unless you put them in a trust, Punt kicked me off Medicaid. Luckily, I have two, at the time two, and still one wonderful parent on Medicare. And as a disabled dependent of someone on Medicare, I get to be gifted Medicare. Is Medicare quite as good and quite as reasonable as something that you want to take as Medicaid? No, and I'll explain why in a few minutes.
Okay.
But it is a single-payer governmental health care. I don't have to worry about whether or not it's accepted, and that is all good. Point number 2, long-term services and supports. This is where Medicare stumbles. And this is where why I don't and will not call it what we're trying to do, Medicare for all. It is at least improved Medicare for all, or Medicaid for all, or even improved Medicaid for all that we are searching for. And that is something that I think is going to be really crucial to set our lodestar to. As Bill said before, in many ways this is a very simple thing that we're trying to do in terms of getting a very complex, very patchwork system to be simple. In other ways, it's not simple at all. And in the area of disability is unfortunately where it's not simple. And it's where things like long-term services and supports, care in the community, home and community-based services, all of those things that we are very good at in Colorado, but are not available to all of us that need them, need to be included in this bill, and they will be because I'm here and because I'm reminding folks that they need to be. That being said, I don't know what my time is.
You may go on. Go on.
Right. So that being said, that is the part of the folks that we can, part of the equation that we can solve by insurance. The other part of the equation that we need to solve, unfortunately, sits at the feet of some, and I do say some because I see providers in the audience that would never, ever, ever do this. But when I was 20 years old, I was happily in college, happily getting my first girlfriend, happily working through my degree, which I then, after that, got on to get my PhD. So life was good. And as a conscientious boyfriend, I went and got myself tested for whether I got any nasty bugs. Well, the nasty bug I was looking for, I was negative for. The nasty bug I was not looking for was hepatitis C. And the nasty bug that I was not looking for, I had contracted, we still don't quite know, but almost certainly within the first month or two of life, due to a blood transfusion that was not screened properly. I was born in 1981, before blood banks did really, really good screening about blood. So, but this story is not about this screening. The story is about hepatologists, and this story is about the way in which we've got to be culturally and disability competent in our providing. And what this story centers on is that I managed to find the most researched, the most educated, the most papered hepatologist in probably the United States, happened to be in Colorado. Great, I thought. I got this nationally renowned guy. Well, sees me, we decide to, we know we've got hepatitis C. I'm fairly low risk. He hasn't done a lot of damage, so he's not real panicked. I'm not real panicked. But we get ready to start treatment. At that point, it was IV immunoglobulin, which was admittedly not the best course of action that we have now, but it was what we had then. And he turns to me and he says, "This is going to be really, really hard on you. It's going to be like having a flu for a better part of a year. I don't think your life is. I don't think your worthy. Your happiness of life, your quality of life, is really worth going through this. It would be too hard on you." Well, A, I'm the one that needs to make that decision, and B,
Yes.
and I would certainly push back on that, but B, how are you going to decide what's worthy? Sure. And so I suppose if it had come down to it, and I really laid my foot down, might have said yes and gone through treatment, but he had said no, that he was not willing to do that, and we were looking for a number of other doctors. Thankfully, an industry that I will almost never tout the benefits of, because they are part of the money-grubbing system that we have described, and that is Big Pharma, came up with what is, I think, quite a miracle drug. And within 12 weeks of a single pill, with no side effects, I am now hepatitis C clear for many, many years. But what that long and meandering story is designed to show is that, yes, we can solve this horrible private healthcare insurance situation that does not allow folks into the system that deserve to be into the system. But once we do that, we need to keep really clear on what it means to be worthy of care. And so, that is certainly my story, and I will leave most of the rest of the things to the audience. For questions, I definitely prefer that than just lecturing at folks. But yeah, that is sort of my story, and from someone who's healthy, but who knows what the future is going to hold.
Yeah, thank you. Well, keep that over there. I have a question. All right, Michael. Yeah. Michael, you told us that Medicare is not as good as Medicaid. Please expand.
Sure. So there are very few Medicare programs that allow for what I suppose also in the insurance world it's called the same thing, but what we call long-term services and supports. Or in Colorado, we call them home and community-based services or waivers. And Colorado's been very good at adopting myriads of waivers. So I'm very proud to live in this state. What waivers essentially do is they offer additional services that are not in what is called the state plan. And what that essentially means for me in practical terms is that I get to live in my home, in my community. I am a homeowner. I am very lucky. I got to go to 2 wonderful schools for undergraduate and graduate school. I got to have a girlfriend. I haven't had one in quite a while, but I got to be out in the community. I got to be, I am looking potentially to get employment, but to do that, of course, I get to take advantage of another Medicaid benefit that is, Colorado in particular, is generous, and that is the Medicaid buy-in. And the Medicaid buy-in allows me to buy in as if Medicaid were a private health insurance in the best possible way. I pay what is a very small, ultimately very small, copay to get employment up to 450% in Colorado of federal poverty line. And as long as I make that, and that is with a number of discards and a complicated formula that even if I you had the time to explain it here, I'm not sure I'd be able to. But it essentially means that you can make up to, I have a friend that's on Denver City Council with a disability on the buy-in. Denver City Council makes about $100,000, $110,000 a year. That's, maybe not a lot for a CEO, but that's a fair living. And he's still on Medicaid. And so I would get to be having employment. I would get to be out in the community. I would get to have an attendant, which is another key thing that Medicaid gets you that Medicare usually doesn't, is attendant care services and physical and occupational therapy. I get to have all of those things and live life, go grocery shopping, go to the movies, go to a concert, which I unfortunately missed last night because my mom turned up sick. But all of those things that I think we take for granted that we can go out and do in the community are things that I can do on Medicaid that I have to rely upon non-paid caregivers to do on Medicare, and that is or I have to private pay, and that is one of the hugest difficulties. So that is why I'm vehement about not wanting to call this the Medicare for all system. Is it better than the private morass that we live in? Yeah, it is. Let me be clear. Is it what we want? It's not.
Improved. Yeah. Okay. Thank you, everybody.